Hello, my name is Kelsie Peterson, and I will be talking about ethical issues within nursing. My specific topic is euthanasia and physician-assisted suicide. What is an ethical issue? It's simply defined as a problem or situation that requires a person or organization to choose between alternatives that must be evaluated as right, which is ethical, or wrong, which is unethical. Physician-assisted suicide and euthanasia. Physician-assisted suicide is when a physician contributes to the death of a patient by providing a prescription that will end the patient's life. The definition of euthanasia is when a physician delivers a lethal dose of medication that leads to the painless killing of a patient suffering from an incurable and painful disease or an irreversible coma. The benefit or harm of death itself. So in the study, they talked about the benefit. The patients wish to avoid loss of dignity or pointless suffering, and then honoring your patient's wish for death. And with the harm of it, they were saying in the study that you just don't know what death is. It's an unknowable variable. We can't experience death. We don't know what these patients are going through. So how can we say that it's okay? And then our own personal beliefs, whether that be religious or moral. Relationships between physician-assisted suicide and euthanasia, and what is also commonly practiced in all states is withholding or withdrawing life support. In the study, one point of view was saying that there was no ethical distinction. It's the same consideration. You're respecting your patient's values and abandoning quantity of life in the interest of saving quality of life. And then the other point of view was saying that there are differences. Withholding or withdrawing life support, your goals are comfort, removal of cumbersome therapies. Your goal can still be achieved whether your patient lives or dies. And with physician-assisted suicide and euthanasia, your goal is only achieved when the patient expires. The morality of the healthcare worker deliberately causing death. Some say this is morally accepted. It's different from murder due to the consent from your patient and being motivated by compassion. You can reduce unnecessary harm if the patient's death is inevitable and the possibility of suffering is unavoidable. And then the other point of view in this study was the respect for the patient doesn't necessarily entail that we can make somebody into a nobody. The management of the conscientious objection related euthanasia in the critical care setting. The objections should be accommodated without obstructing the patient's access to medical intervention. The physicians and healthcare team must discuss all possible options for treating a patient that is suffering and recognize the difference between restricting their medical actions and obstructing the patient's right to healthcare access, whether that be to end their own life or not. And here is the list of recommendations. This was a table in the study that the peer review study that I went over. Some of them is to accommodate the accommodation will not impede a patient's or surrogate's timely access to medical services or information. And also the institution should promote open moral dialogue, advance measures to minimize moral distress, and generally foster a culture that respects diverse values in the critical care setting. And also another study that I pulled, there was 3 studies conducted and it interviewed 405 physicians. The alleviation of pain and symptoms with high doses of opiates that the patient's lifespan might be shortened was the most crucial in the medical decision of ending life care, equaling 17.5% of all of the deaths. And another 17.5%, a non-treatment decision was the most valued medical decision in end-of-life care. Euthanasia by administering lethal drugs at the patient's request showed to have been done in 1.8% of all deaths. Since medical decisions in end-of-life care were taken in 38% of all deaths, the study concludes that these decisions are common medical practice and should get more attention in research, teaching, and public debate. For legal concepts, the physician-assisted suicide is currently legal within Oregon, Washington State, Colorado, Hawaii, Vermont, Montana, Washington, D.C., and California. The physician-assisted suicide does currently differ from euthanasia, which is not currently legal, but due to euthanasia being the physician gives the actual lethal dose, physician-assisted suicide is when there's a prescription and the patient is the one that actually takes the medication and is not lethally given the dose by the doctor. The patient must be competent and not clinically depressed. Some nursing implications that I gathered from the research that I've done is that you could be sued by the family if they were not accepting of their family, if the family was not accepting of the patient's choice to end their life. And also, if you decide to practice physician-assisted suicide or euthanasia in a legal state, you will lose your RN license. And then also our own religious or moral values against euthanasia, if you have those. For personal use of the information on euthanasia, if it were to become legal within my state, I'm going to respect my patient's wishes. I'm going to set aside my own personal beliefs and always advocate for my patient and respect their choices. And here is a copy of my references. I hope you all have a wonderful day. Thank you for listening.